anyone out there feel like we need a healthcare revolution? Does anyone out there feel like our medical system is not serving them very well? I mean, in certain ways it does. Like, it's great for emergencies. And it's really good once things have progressed to a point where medical management is the only way to go. But do you feel like our medical system is helping you stay healthy? And is it preventing illness or reversing illness or just managing illness? Well, most people I talk to feel like there's some huge problems out there. And that's what I'm seeing behind the desk. I see people kicking around the medical establishment and not getting the help that they really need. And also, there's some sad things happening where if someone has a serious illness, let's say they've been diagnosed with cancer, sometimes it can take weeks to get into an oncologist, or they develop a kidney problem, weeks to get into the nephrologist or the rheumatologist, you name it. So we have a bit of a crisis on our hands. And what I think is that we need to really step back and look at how do we create a different model altogether, a model that combines integrative medicine with lifestyle science, because there's so much that we know nowadays that can keep us healthy and prevent us from developing degenerative and chronic diseases that then require that you enter into the standard medical model. So that is what I'm committed to. And that's what I'm doing here at Jizen, where we are working with the best integrative medicine in the world. We really have true medical detectives here. And we are both educating people about and coaching people around lifestyle practices that they can do, and then data driving the work. So let's say we curate a program for someone. We are proving that it's working by collating data streams from blood labs, from wearable devices like the Oura Ring, the Whoop, the Smart Scale, continuous glucose monitors when indicated, and even from biometric testing like VO2 max, resting metabolic rate, and more sophisticated body comp analysis. So when you can data drive what you're doing, let's say you are intermittent fasting. Let's say you are spending time outside in the morning. Let's say you are doing high intensity interval training 3 times a week. Let's say you're doing meditative practices, and then you can see what those things are doing to your deep sleep quantity, to your heart rate variability, to your blood sugar balance. You will be motivated to keep it up. And we have the knowledge nowadays, and we have the tools to support people to live in a healthy way so that they don't have to walk down the road toward chronic disease and degeneration. But one thing that's important that I want everyone to think about is your mindset. It matters. You have to see something different for yourself and not be influenced by external evidence to the contrary. We see people getting sicker. We see life expectancy in the United States dropping from 78.8 years down to 76 now. And we see obesity rising. We see obesity in children rising. We see that 20% of women in some demographics are taking antidepressants. We see that 60% of adults have been prescribed pharmaceuticals, and 15% of adults have been prescribed 5 or more pharmaceuticals. We know that mismanaged pharmaceuticals, drug-drug interactions, and even bad drug reactions are one of the leading causes of death. So going down pharmaceutical management for chronic health problems instead of looking at how we can prevent them is the wrong path. and there's so much we can do to right it. So I want everyone to feel empowered that you can take your health back into your own hands when you have a clear path and the right guidance.